International researchers say it's not time yet for healthy vaccinated adults to get COVID-19 booster shots, but the Biden administration wants to make them available September 20th. News 12 Connecticut's Sean McCabe has more on who might be eligible.
The decision of which booster shots to give, when to start them, and who will give them will be left completely to the scientists at the FDA and the Centers for Disease Control.
The Biden administration initially calling for all Americans to be eligible for boosters 8 months after their final dose.
Doesn't look like that's going to happen. They're seeing a fair amount of pushback both from CDC and potentially from FDA.
Dr. Perry Wilson is a physician with Yale Medicine. He says the data does show efficacy from the COVID-19 vaccine drops over time.
Efficacy at preventing symptomatic disease has waned a little bit, depending on your age group, might be down to 80% or so.
But a report published in the Lancet Journal yesterday finds that the shots are still working, and it's not time for a booster yet.
Even now, even in the face of Delta, even in people who are fairly far out from their initial vaccination, the vaccines remain highly effective against serious illness, hospitalization, and death from COVID-19.
Dr. Wilson says getting all Americans their first shot is more important than thinking about getting some of them a third.
35% of eligible adults are still not vaccinated. And of course, in some parts of the country, it's the majority of eligible adults who are not yet vaccinated.
He does expect the FDA and CDC to recommend boosters for those with compromised immune systems and likely for seniors.
Maybe people above age 65, probably at least for people above age 75, because the data really does show that immunity might be waning in that population.
Sean McCabe, News 12, Connecticut.
This week, the FDA and CDC are expected to advise the White House on who should be eligible for COVID-19 boosters and when.